I think we can make sure I do this
This
before.
will be next to Dr. Ralph's
Okay.
turtleneck,
Start over.
basement
The
video.
turtleneck.
Everything on there.
That's awesome. Right. If we're gonna do that, I'll make sure I use the paper that's already looking nice.
We'll do the good looking kid.
Okay, so. Our Bakri postpartum balloon we use for uterine tamponade for the lower uterine segment.
And we're gonna use 500 of normal saline.
Okay. So this package comes sterile. You open it. So if you would want to have sterile gloves to hand the doctor items, or they can take the items themselves, they are the part that comes off the top here is the part that no longer needs to be sterile. So this can be handed off. This is the tubing that you will use to spike your normal saline. That's not supposed to go in. Now you have a red cap on the end here. You have your T-piece. There's a red cap, a red tag on there that shows you connect red to red. In this T-piece is a one-way valve, so you'll be able to connect a syringe and continuously pull back and fill the Bakri without having to disconnect anything. So with this T-piece, then the provider is going to have this sterile and hand this off to the nurse.
You're gonna go into one end of it. So that's gonna go there. And you wanna make sure this is tight so that it doesn't become disconnected, otherwise you'll get flooded. Like that.
This is the port that can easily come loose. If that comes loose, then all of the fluids will come out, so.
Why is this on? Okay.
Okay. And then we have the syringe.
Secure that.
So our blue
Is open to
T-piece, not T-piece, our blue
stopcock.
stopcock needs to be turned the right way. That is off, that is on. So the provider will place the balloon and then ask the nurse to start filling. As she's filling, she's priming the tubing at the same time, so she will have some air collect in the syringe. She can
So we're gonna clamp this.
She can disconnect it right here because it's a one-way valve. Nothing will flow out. Release her air. Now from here on, she can continuously pull her syringe to 60 cc's. And then fill. Each time we pull, and when we're filling, we tell the provider, okay, 60 cc's going in. And they'll tell us if they would like another, so do another 60 in.
You don't have to put it on stop when you
Nope.
withdraw?
No, because it's one, this is one
A
way.
one-way valve right here, so she
So
can
it
keep
only
going
can-
back and forth. And this is a
It's hard to
500 cc
pull.
max. That's one reason why we use the 500 cc normal saline bag, is you cannot overfill it because you don't have enough fluid to overfill it with.
How much do they usually end up filling it with?
I think it's usually around 300.
Most of the patients I experience, it's 200 to 300.
200 to 300.
So each time I fill with 60, I'll say to the provider, okay, the 60 in, do you want another 60? They may ask, what's your total? So
Yep.
you have to keep track of that as you're going. And once that's complete and they feel they've had enough, so then we will turn the blue stopcock sideways. And so now your flow outward is stopped. You can disconnect right here. You want to keep that blue stopcock on so that we keep the fluid inside. Also, at the end of this, you'll put
Saline lock.
the saline lock cap on as an extra precaution, so it's both covering this port, and if accidentally this gets turned because it's taped to that patient's leg for a while, then it will keep the fluid from flowing out easily. Whenever we're checking on the patients, checking the flow and everything, we should always be making sure that that cap is still, that stopcock is still turned the right way.
Do they put a vag pack in too?
Sometimes they do. So this, it does come with,
There's a
I
veg
don't know if
pack
I have
sticker,
it.
and that will
There's-
go on the
Yep,
on
this is a
the
large
bag.
pink And
Oh,
you
okay.
document this sticker right here. You document how
okay.
many packs may be in,
Yeah,
or if there aren't any, you should still write that there's none, just so
There
that
aren't
it's,
any,
you know,
okay.
under nose,
Yeah.
you know.
So those are the two LDAs then, one for the Bakri and one for the veg pack,
If this one, yes.
right? Yeah.
And
then-
do you use a green top on the, end there, or no?
On the Laura lock?
Yeah.
Yes, you can, I
I
think.
would just,
You can,
yeah,
okay.
just because it's
Yep.
another port to anything,
Okay.
so. And also at the end of the Bakri, this is the drainage. We have holes at the end, just like a Foley for drainage, so you want to have this attached to a urimeter bag. The urimeter bag specifically because it will measure the small increments. You don't have as much output from a Bakri, hopefully. So if you only have, say, 20 cc's in an hour, you'll be able to see that much more clearly with the urimeter bag versus the regular standard drainage bag. If you have concerns about the flow, when you're checking on the uterus, if it's rising, but you don't see anything coming out into the bag, you wanna make sure that it's not a clogged Bakri. So you can check your hospital policy for the next steps with that, and contact your provider if you'd like,
how long do they leave them in, 24?
usually.
And if it's clogged like that, like, cause we get a lot of patients over on MISCU, would the provider actually come over and kind of flush and play with it?
It can be flushed. Before I would flush it, I would contact the provider just to make
Oh,
sure
yeah,
that
yeah,
they
yeah,
understand
yeah.
there's a
But is it
complication
something
and
that
they
they
may
do,
wanna
or
be
is it
in-
something that we can try to?
We can.
You can?
We can, yes, but they may want to be involved, so
Yeah.
it's always good to confirm that with them
Yeah.
first.
And which one would you flush? The stopcock end, or that end?
This-
That
this
end,
is where
okay.
the drainage is
Okay.
coming from, and you know,
All
the
right,
blood can clot and, you know, the
Crowley
green
bag.
could easily block those.
Is it the
holes.
green?
Okay.